Now let's learn how to evaluate. How to evaluate low back pain. Okay. Whenever you get a patient of low back pain, you have to ask four things. Okay, is is there any is there any neurological deficit? Neurological deficit. Okay, is it associated? Is it associated with systemic illness? Is it inflammatory back pain? Okay, inflammatory back pain, or is there any evidence of social or psychological factor that may complicate chronic pain? You have to know these four things, three to four things, before evaluating or before giving conclusion of low back pain. First of all, we have to know if there is a neurological deficit or not. If there is a neurological deficit, okay, that means some peripheral knob or the central knob is compressed. Okay, there might be direct compression or direct compression of our spinal cord or spinal knob root. Okay, and which may be causing our pain. So this is so serious, and we have to look for imaging. Okay, like there is radicular pains like weakness, our this pain, sensory disturbance, okay, reflex changes, okay, like in Cauda equina syndrome, there will be loss of our bowel and bladder, this bowel and bladder control. In Cauda equina syndrome, there is lower limb weakness, and loss of bowel and bladder control, and this is important. Okay? We have to evaluate this and treat as much as possible. Okay? So whenever there is a neurological deficit. Now, second thing we have to evaluate during evaluation of low back pain is if there is any systemic illness. Okay, any systemic illness like diabetes mellitus, any like tuberculosis. Okay, or any other conditions like use of prolonged steroid, long term. Okay, long term steroid use, UTI, or if there is something like that, osteoporosis, then there might be condition where this, if you treat this condition, our low back pain is treated, or sometimes this may have complicated the back pain. Okay, that's why we have to treat this and look for any possible complication caused by this illness. Okay, after that, and the third most thing is any inflammatory, if that low back pain is likely to be inflammatory or not. Inflammatory type of low back pain, as we see in ankylosing spondylitis, okay, are mostly night pain with early morning stiffness. If these two things are present, no, early morning stiffness, then it's mostly inflammatory type of back pain and usually seen in young age. Okay, and if you have seen this type of pain, then you have to send for inflammatory marker. Okay, and the fourth thing is psychological factor. If there is like history of psychiatric illness, or if the patient has a chronic pain, and if there is any factor that like there any factors like substance abuse, history of depression. Okay, like this, if there's anything that lead to a psychiatric illness, then that might be cause of low back pain, and it's very difficult to treat this type of patient. So finally, before evaluation of low back pain, you have to know these three to four things, so that it will very easy for us during evaluation of low back pain.